Good morning. Welcome to Breakfast with Sally Nugent and John Kay.
Now, at exactly 29 minutes past 6, more than 250,000 appointments and operations across England could be impacted this week because of the junior doctor strike.
So here's what you need to know. NHS England says appointments will only be cancelled where necessary and you will be rebooked immediately where possible.
Now, if you've not been contacted, you should attend your appointment as planned and GP practices will remain open.
If you're feeling unwell, NHS 111 online should be your first port of call for any health advice.
And you should only dial 999 if it's a life-threatening emergency. Patients who need urgent medical care should continue to come forward as normal.
But NHS leaders are also warning people to avoid risky behaviour as services such as A&E will be under greater pressure than usual. Let's talk about this some more, shall we, with Dr. Nigat Arif, who joins us on Breakfast. Good morning, Nigat. Thanks for joining us bright and early on a Tuesday morning. Can we talk about on the GP side of things, because that's the first contact a lot of people will have with the NHS on a day-to-day basis. Are you expecting as GPs that there will be an impact on you as well, although you're not junior doctors per se?
Do you know what? We cannot underestimate the impact that this will have, because junior doctors work across the NHS. We do have trainee GPs who are considered junior doctors. So junior doctors are anybody who isn't consultant level or at a senior GP level. So that's anybody that's in training, and that could be in training for up to 10 years. So in fact, GP practices are going to be impacted if that trainee doctor is a member of the BMA and has said that they're going to strike. So appointments are going to be impacted in regards to your access to the appointment that you might have at the GP surgery. Now, I completely support my junior doctors from striking. This is something that I think has been going on for a very long time, and it's impacting mental well-being, it's impacting morale, it's impacting burnout, and junior doctors are leaving the healthcare system because they are the bloodline of the NHS and are functioning. So in regards to somebody waking up this morning who wants to make an appointment to the GP surgery, yes, there might be delays. I know in some GP surgeries, what they've said is that they're going to have no routine bookable appointments, and they're just going to deal with on-the-day urgent things in order to cope with the fact that this is a 4-day strike, and this will impact the care that we deliver to our patients. Mental health services, so outpatient mental health services, they also are run by junior doctors as well. So I know that they're also going to be impacted. It's not just hospitals, it's community care that's going to be impacted by this, John.
I guess every surgery, every practice is going to be different, isn't it, in terms of its membership and its makeup of staff. But it sounds like a lot of people might be affected this week who aren't expecting to be affected.
Exactly. I mean, look, my own case, my son is 8 years old and he's had a liver transplant, and he's due to have a hospital appointment this week, actually, and it's been cancelled. An appointment that I've been waiting for 9 months or so. And it's something that I'm actually okay with, because I know that the most important thing is that the junior doctors, this isn't a lightly taken scenario at all. They're striking because they really are struggling. £14 an hour to save your relatives or your loved one's life is crazy at the moment, and negotiations haven't even started. And this is something that I think that has been, like I was saying earlier, impacting on care for a very long time. Junior doctors have worked immensely hard throughout COVID. We in primary care have been working alongside our colleagues who are training as well at the same time. And now the other end, it doesn't feel like we're being actually applauded, recompensed in regards to the fact that cost of living crisis is going up at the same time. Junior doctors have families, they're married with children, with care, people that they need to support. And in regards to the impact that they're having, this is going to be really frustrating. But we have to do this, because even without the doctors striking, the NHS is struggling. How many times have I come on here and said, look, in general practice, we're struggling as well, because it's the whole makeup. We're a whole team of individuals that make up the care. And so at the moment, yes, frustrations will be high. Yes, appointments are going to be impacted, but we are always here, and the NHS is open to look after you in the case of an emergency.
You're obviously sympathetic and understanding of this. We heard from some other patients in a piece earlier who were less sympathetic and were really quite angry that their appointments were being cancelled due to this industrial action, and really worried about the knock-on effects, because we know that last month, for a shorter strike, 175,000 appointments and operations were cancelled. The backlog even after this latest strike is over on Friday, could be much, much longer, couldn't it?
It could be much longer, and we could be even having further strikes later on down the line. And on the back of it, we've just come out of a 4-day Easter weekend as well. So obviously I can completely empathise with my patients who are frustrated. Look, I work in the NHS and I was a junior doctor. I'm currently a GP who's supporting my colleagues junior colleagues in my GP practice as well, and training my colleagues. So the frustrations are high everywhere. But at the end of the day, this is something that is really critical because we're hemorrhaging doctors. Doctors are leaving the workforce at the moment within the NHS. The NHS will struggle to survive if we don't meet the demands that are being made, but also somehow recompense the junior doctors in regards to the value that they bring to the service. The other thing that's really important as well is that, yes, they are striking, but senior colleagues, consultants who are supporting them are stepping in. So if anybody is struggling to get an appointment, urgent appointment, there are walk-in centres that you can go to, as you said earlier, NHS 111 online, your community pharmacists, allied healthcare professionals, the nurse practitioners in the communities. If you've got say a midwifery problem or your child is poorly, you can also talk to your community midwife. Also, oh my goodness, it's gone out my brain. But oh my goodness.
Don't worry at all.
That happens to me every single day. I feel so much better. It happens to you too.
And I think there are so many different channels and departments and numbers and websites out there. Yeah,
there are, and there are individuals that are there to support you. And appointments are going to be rebooked later on. But the significant thing is this is going to impact the backlog that we've got. And frustrations are really high because I'm feeling it as a parent, but also as a GP. But this is so necessary to support the junior doctors in order to make sure that they stay within the workforce.
Dr. Nighat Arif, thank you very much indeed for joining us. Hope everything is good with your boy as well. Thank you for joining us on Breakfast.
Yeah, he's good. Thank you.
Great to see you, Nighat. I haven't seen her in ages.
Absolutely.
It is 6:36 now.